Good morning, everyone. Today is Thursday, July 12th. My name is Deb Wilkinson. I'm the Vice President of the Health Plan Options Department at URL, and I thank you for joining into our weekly healthcare reform webinars. There is a lot of information to go over today. Questions are definitely encouraged, so there are a couple ways to do that. If you're new to the program, you just click your electronic hand if you want to raise your hand and ask a question live. I will unmute you at the end of the webinar, or you can type in your question in the question box and I'll answer that also at the end of the webinar. I've been running these webinars for almost 5 years now, believe it or not. And, there are still so many changes going on, I think now more than ever, with, trying to dismantle this law, but there are some adverse effects to it. But, for those of you that are new to the program, I really try to stick with some legislative updates, not only for Pennsylvania, but on a national platform. I talk also about the health plans within the state of Pennsylvania. Some of them also have a national presence. So those are the type of things that you can learn here on a weekly basis. And of course, again, your questions are encouraged because that just helps me know what you're being asked in the field and helps me research any questions that I don't know. So, this is a community thing here. We have to get through this law. I've always said it's going to take a village to get through this law, and it certainly has, 4 years later. So let's get into the agenda. All right, here we go. We've talked a lot about the association health plans and, the fact that details were released, the guidelines really kind of expand the definition of employer and employee. A lot of folks expect that there's going to be some pushback from the DOL. Our state, Pennsylvania, we're not a huge fan of association health plans. So I do have a message into our PAHU Leg Team, the Pennsylvania Association of Health Underwriters Leg Team, to see if they have had any correspondence directly with our insurance commissioner about, the viability of these plans. I know the carriers are way down the road on these things. The established associations are all communicating with the carriers. My question really relative to Pennsylvania and of course any other state is, what about new associations? What are the likelihood of approvals for new associations? And I think that's where the state insurance commissioners could make it difficult for, some of the newer associations forming because of the health insurance. So we'll keep an eye on it. These plans, as I mentioned before, tend to blow up pretty quickly, and we're really looking at it for a 3 to 5 year window. I hope we're wrong, but that's kind of how we're looking at it. So the big one, the risk adjustment payments, they were suspended for any of you that were still celebrating your Independence Day holiday on Saturday. You probably saw some fireworks of your own, but the risk adjustment payments have been suspended. Those are the risk adjustment payments where they look at the insurance carriers within all of the states, and the carriers that took on more risk actually are subsidized by the carriers that took on less. So, it's all over the board. Bottom line, this is probably good news for the carriers that were anticipating a large payment to the fund, and it's probably pretty bad news for the carriers that were expecting some large payments. This could adversely affect the rates. We're still waiting to see if CMS, HHS are going to allow for refiling, maybe filing for 2 different rates. One, if the suspension of the risk adjustments is final, or if it's overturned, then the lower rates. So this could have an impact on 2019 rates that were an estimated, I believe, 4% increase here in Pennsylvania, and also on the small group rates as well. So we'll keep watching it, but President Trump they are trying to dismantle this law, and I think, unfortunately, the adverse effects of dismantling and piecemealing some of these changes is exactly this. It doesn't do anything to stabilize the market, so it's still very volatile, and because of that, and because of the unknown profits, et cetera, from the carriers, I think we're just going to see higher rates than we thought originally. But again, more to follow. For those of you that are still in the individual market, CMS offers compliance tips to brokers selling in the marketplace. I did attach the tip sheet and the PowerPoint. It's in the webinar here. So if you can't pull that up or print it, let me know. Just shoot me an email, and I'm happy to send you those two things. Basically, they're asking that you record the call, you record the fact that, why you're using the information or collecting the data, and the permission from the consumer to allow you to do so. They do say that the BORs, broker of record letters from the carriers should suffice. Obviously, if they sign it that you're the agent and that you're collecting data, then they feel this is safe for you, I guess. But again, keep looking at it, or look at the stuff, and base your sales on those tips, if you will. Another reduction in navigator grants. This just came out last year. If you recall, federal dollars were reduced from $62.5 million to $36.8 million. They are now being reduced to $10 million for the 2019 selling season, and advertising funds have now totally been reduced by 90%. This is huge. Obviously, this is another part of dismantling this law, but the adverse effects are that nobody knows about it, and enrollment, I guess, is not what anybody wants. There was another article that just came out about navigators and navigator grants, and allowing navigators possibly to do more as in talk about association health plans, or talk about short-term medical as an option. And remember, navigators are supposed to just be offering options, information. They are not licensed entities. They actually are prohibited from being licensed entities. So the article that I read, and it will be in next week's HDR newsletter, talks about them trying to recruit life insurance agents to do the marketplace sales because they're not licensed for health, not receiving health commissions, so they could actually apply for a navigator grant. Yeah, you just can't make this stuff up. So again, I wanted to at least let you know that. And let's see what else. Also, there are some bills that are being bandied around from the House Ways and Means Committee about some changes, some positive changes for HSAs. So we'll keep watching that, but some of the bill's parameters are increasing HSA contributions. Another bill is allowing seniors eligible for but not enrolled in Medicare Part A to continue making HSA contributions, ensuring that all Obamacare, bronze, and catastrophic plans qualify for HSAs. So again, they're talking about these things. Expansion of HSAs is certainly something on the Republican side that's looked at in a positive light. But again, these are just new things that came out overnight, and I will keep watching and letting you know how everything is shaping up. Okay, so let's get on to our agenda. This is also for everyone out there, not just specific to Pennsylvania, but PCORI fees are due July 31st, and employers with general, well, let me back up. PCORI fees are for a fully insured plan. PCORI fees are typically paid by the insurance carrier. Employers with general purpose FSAs and HRAs integrated with self-insured plans must be mindful of the due date because employers are responsible for filing and paying the PCORI fees. So there is information about the PCORI fees, again, attached to this webinar. If you can't download them, just let me know, and I'm happy to send you that as well. Let's see here. Aetna news. if you're logging into Producer World or the Senior Supplemental portal, you're going to get, pardon me, you're going to get a notice of alert sec access, and it's really an encryption sort of software. It's free to you. It's downloaded locally, and it's going to be a soft rollout, and when you go in, you have the ability to skip over it, but ultimately you're going to have to download this security system or software in order to access their site. So that's coming soon. New groups can also now allow employees to self-enroll as first-time users. So when you no longer have to wait for your invitation, you can go in and use first-time users. Another thing, 12/1 rates for the Aetna AFA are going to be available August 1st, so that's just right around the corner. So we are essentially 2 weeks away from fourth quarter craziness, if you will. And there's a lot more on Aetna in the healthcare reform newsletter. I just couldn't include it all. Cap Blue Cross, group online billing and payment history, that's coming in August as well, where a group can go on, see their billing history, the payment history, and push or pull that group billing rather than waiting for the bill to come out. Multiple eGEMS updates in one transaction, that's huge. And again, there's a lot more in their connection newsletter in my newsletter. UPM Producers Resource Guide, this is huge. UPMC has been a Western PA carrier, and it is moving across the state rather rapidly. There is a resource guide that was that just came out last week. It is on our group resource page. It does have some information about the expansion territories. So for those of you east of Pittsburgh, and wanting to sell UPMC individual or UPMC group, I'd take a look at that resource page because that's going to give you some good information on the networks. Upcoming events, September 5th here in Hershey, here in Harrisburg and at Hershey, it's located at Hershey. September 5th, our annual Medicare Connections Conference. This is a huge event. We already have about 150 folks signed up, and the advertisement just went out. So it is a very well attended event. If you are selling in the Medicare market or are, have interest in the Medicare market, this is the place to be. It's an all-day event. Lunch and breakfast is served, snacks, all kind of things. But the carriers, more importantly, will be there giving you a preview of what you're going to be selling for January 1st of 19. So again, that's a huge event. The Central Pennsylvania Association of Health Underwriters is also having a Medicare Summit. It's their first. That is September 13th, and that's at the Holiday Inn East. There is a cost to that for non-NAHU members and NAHU members, but we'll have more details as they come out. And then again, for those of you that are interested in the expansion, UPMC is having training August 1st at the West Shore Country Club from 9 to 11, August 2nd from 9 to 11 at the Reading Hospital Tower Health, and then Tuesday, August 14th, 9 to 11 at UPMC Susquehanna Williamsport. That information is in my newsletter, so if you are interested in learning more about their expansion and the products, I would encourage you to sign up for one of those seminars. FFM certification for 2018, that is ending. They're going to pull that as of July 18th. So if you've not done the FFM certification for 2018 and or any carrier requirements, specifically Highmark requires you to do the ethics training, I would encourage you to do that by July 18th, because I can tell you last year, some of our agent partners went through the year selling, of course, no commissions during SEP, but they were compensated and then had commissions pulled back because they did not complete their ethics training or the FFM certification. So just be mindful of that. You guys work awfully hard for that, those pennies that the carriers are paying us on the individual side, and I'd hate to see that taken away. So just be mindful of it. That's it. That's time for our open discussion. I always thank you for joining our forum, of course. So if you have your questions, I'll get to those while you're formulating them. We will be back here on July 19th, which is next week. The following week, I will be on vacation, but just wanted to kind of remind you of that early. So let's see what kind of questions we have, if any. We do. How do navigators get paid? They get paid through grants, Dave. And do small group employers who have a TPA who is not the fully insured provider have to file and pay those PAHU fees? So a TPA who is not the fully insured provider have to file and pay those fees. Well, Dave, I would say it depends on what services that TPA is providing. If they're providing, you know, HRA or FSA, then they typically do not pay those fees for you. But again, that's all over the board, so I can't really answer that. Elise says any 8/1/18 Capital Blue Cross terminations are due by 3 p.m. on July 25th. That's group, of course. So just be mindful of that. The carriers have really been buckling down on term dates, so make sure you're mindful of that. Melissa asks if we have heard any release dates for the carrier-specific Medicare certification training. I have not, Melissa, but I will take that question back to Christy Wilbert and Karen McDaniel, and I'll get you an answer. I think it's soon. I know that they talked on Wednesday about the first day of AHIP testing, I believe. Oh, I just found out they're all on our website. So, Melissa, you can go to our website and you can learn about those dates. So that is it. Those are all of our questions that we have for today. Again, if you can't download some of these things that I attached as handouts, shoot me an email. My email address is debw@urlinsgroup.com. And keep the questions coming. I'm happy to answer questions offline as well. And for those of you that will be here and around next week, I thank you for joining in and hope to talk with you next week. So until then, I wish you a great balance of the week and a wonderful weekend. Thanks so much for joining in. Bye-bye.